So we're here with Werner. He's our male patient that we're taking on this journey. Werner is 41 years old. He's an active sportsman. He's an endurance athlete. And Werner has some of the signs that we typically see in these kinds of patients. So Werner, if you take a look in the mirror, show us the things that bug you most.
Well, first signs are the wrinkles on my forehead, the bags underneath my eyes, and then the droopiness of my whole face. It just feels like everything's falling down, so just feeling a lot older. And there's obviously a lot of wrinkles now.
Okay. So we've identified your needs. For us to do a proper treatment, what we need to do is we need to establish the underlying causes of this. So I'm going to run through a quick assessment and then give an explanation of why we're seeing what we're seeing. So Werner has complained about excessive lines on the forehead. Now these are dynamic lines, lines that form with movement. This is an easy thing to treat. We use a little bit of botulinum toxin and it just softens the contraction of the muscle. If we do it correctly in a way that gives us movement, it looks very natural in men. So Werner hasn't really complained about the frown lines, but I think softening them as well will open up the eye area, giving him a softer, more approachable look. He's complained about bags that form under the eye. Now, we can see slight puffiness under both eyes. But what's far more pronounced, and if we look at his photos, we can see that there's volume loss in the mid-face. And if we restore some of that volume, we can see that immediately he starts looking fresher and more rested. You complained about sagging in the face. Now, sagging happens for a couple of reasons. Number one is there's a decline in collagen production in the skin, and this leads to 4 typical signs. The first one is laxity of the skin. So if we look at laxity, we do a pinch test. If you can start pulling the skin away from the face, it shows laxity. If we take a look at this, we can see just how mobile the skin is. So the combination of laxity and sagging is creating the appearance of a jowl and the nasolabial fold. So if we do this and we lift the skin, you can immediately see an improvement in the neck as well as in the nasolabial fold. I want you to pay attention to the improvement in volume in the mid-face when we redrape the skin as well. So luminosity is another problem of collagen loss. We see dullness in the skin, and Werner actually has some pigmentation irregularities. This can also be due to sun exposure and other environmental factors. One of the major signs of aging is volume loss, and we can see that we have slight temple hollowing, which is creating a sagging in the lateral brow. This is the support structure for the whole of the face. So when we re-volumize the temple, you can see that everything starts lifting. We have some volume loss in the pre-auricular area in front of the ear, and then major volume loss in his mid-face. This is typical of endurance athletes, people who are naturally very thin, or people that have lost weight quite rapidly. The fat pads, which acts as the support structure, starts disintegrating. We also have bony changes that happen as we get older. And on the insert, we are highlighting some of them. So here we can see that there are marked changes to the bone as we get older. First, we see that there is recession in the mid-face or the maxillary area. There's also a change in the hollow next to the nose. And then one of the major changes that happen is to the mandible or the jawbone itself. we see that the angle of the jaw starts opening up. The height of the bone also starts to decrease. There's change to the dentition, and then marked changes towards the height in the front of the mandible itself, and then changes to the chin. Suffice to say that the maxillary area, this is the cheek area, starts flattening and even recessing. The eye bags form because of lack of support of this tissue. Furthermore, the shape of your eye socket starts changing. It becomes more oval as we become older, and this leads to the unsightly tear trough formation and compounds the signs of eye bags. For men, we want a strong, defined and angular jawline. Now, Wagner has all of that, but we can start seeing an appearance of slight jowliness, and this is all due to drooping and sagging of the skin. So revolumizing the midface is going to give us structure as well as definition, with a lift in the jawline and decrease in the nasolabial fold. Now, Wagner has a strong mascular chin, one of his strongest characteristics. In my experience, the most inhibiting fear that men have around aesthetic treatments is that we will create an unnatural look or feminize them. If we stay true to the principle of not over-volumizing, but creating structure and angularity in the face, especially in the jawline and chin, we always get a very good result. Lips play an incredibly important role in the overall male aesthetic, and I think this is something that most men would hesitate to do. Thin lips detract, and by creating a slight projection and volumization of the red lip itself, it adds to attractiveness, handsomeness, and even make us more sexy. In order to create a good aesthetic outcome, it is essential that we understand the anatomy of the face, the dynamic working of facial muscles. A change as little as 1 millimeter in a brow conveys a different expression to the people around you. Knowing the products and their properties allows us to place the product correctly, not over-feminize, and we'll be taking a look at this as we continue on this aesthetic journey.